On to the third talk for this morning and the last one before you have a break for lunch, which is by Anthony Mysak from Guy's and St Thomas's Charity, The Impact on Urban Health. And he leads the program work on schools, in-home air pollution and the public realm. And he's going to talk about supporting schools to engage with and tackle air pollution. So Anthony, over to you.
Can you see my screen?
And I can see your screen. Perfect.
All right. Well, thank you so much for inviting me along to speak today. So, building on some of the early conversations, sort of be talking a bit more of a practical approach to how we as a foundation are working in schools to tackle air pollution and sort of some of the impacts of COVID on our work as well. So I'll quickly introduce Impact on Urban Health and our Health Effects of Air Pollution program, and then I'll talk through our work to support schools to engage with and tackle air pollution, including what we have learned so far and what that means for our work with schools in the future. So I'm sure many of you probably haven't heard of Impact on Urban Health. We only changed our name at the start of this year, but we're part of Guy's and St Thomas's Foundation. We are an urban health foundation which works in partnership to take a place-based approach to tackling complex health issues and address systemic issues. We use our home of Lambeth and Southwark as testbeds to test and learn about what works to address these challenges and achieve improved health outcomes. We take a programmatic approach to achieve impact and currently have 4 core programs. We are working to reduce childhood obesity, to slow down and stop people's progression from one to many long-term conditions, to prevent and support adolescent mental health issues, and relevant here, to address a program focused on the addressing of health effects of air pollution. So last year, we launched a 10-year program to explore how people's health is affected by air pollution and test solutions to mitigate these effects. We are particularly focused on the most vulnerable to the health effects, including children, pregnant women, the elderly, and those with existing conditions. As we develop the program, we have 4 key priorities. We want to create a compelling case for change by generating high-quality evidence about the health effects of air pollution, as well as the effectiveness of interventions. We want to engage and amplify voices of the most impacted, particularly Black, Asian, and other ethnic minority groups whose voices have been missing or ignored in conversations about air pollution to date. To reduce exposure to air pollution in the environments where people, especially the most vulnerable, spend their time. This includes schools and nurseries, the home and health and aged care facilities. And we are also exploring how to work with business to find equitable solutions to reducing emissions and air pollution. So important for us as a charity focused on health inequalities is understanding how health effects of air pollution affects and relates to inequalities. We see it as an issue that drives and exacerbates existing inequalities, particularly health inequalities. We see these inequalities as 4-fold. Those most impacted by air pollution are least likely to contribute to it, i.e. they're less likely to own a car and a wood burner, etc. They're the most affected are often least able to mitigate the effects of air pollution, i.e. choosing where to live in a less polluted area. Those most impacted by air pollution are often more likely to be negatively impacted by other determinants of health, such as unemployment, low income, and systemic racism. Our evidence also suggests that those most impacted by air pollution are less likely to be engaged or heard in decisions to address air pollution. There is also growing evidence of how COVID-19 is exacerbating these existing inequalities and disproportionately affecting many of the same groups who are disproportionately impacted by air pollution, particularly communities of colour. So why I'm here today, air pollution in schools. It is important for us to consider relevant inequalities associated with air pollution in schools. There is increasing evidence of the association between air pollution around schools and measures of deprivation and inequalities. And also the inequality and deprivation doesn't just impact children's exposure to air pollution in and around the school, but also the capacity of school community to mitigate these effects, as we sort of noted there. So what do we want to do? There is an impressive amount of work already being done around air pollution in schools. The TAPIS network is evidence of that. There is, however, a clear gap between the energy and resources being spent on addressing air pollution around schools and robust evidence of what is most effective. So we at Impact on Urban Health have a unique opportunity to help bridge this gap by testing and evaluating the impact of the most popular interventions to identify which are most effective at reducing air pollution and exposure to air pollution in and around schools. At this stage, we are somewhat agnostic about the interventions we test and evaluate, but want to build on existing evidence and research where possible. Through our existing projects and those in our pipeline, we are hoping to better understand the impact of interventions like building improvements, including retrofits, replacing boilers and improving ventilation, school design, including playground design and location, the impact of green infrastructure, the impact of behavioural change, including active travel interventions, parent and pupil-led interventions, including anti-idling campaigns, as well as standalone air filtration and purification systems as well. We have 4 projects around air pollution in schools running so far. Our most significant project to date is our Clean Air for Schools Lambeth pilot. Here we are working with Global Action Plan, the GCARE at University of Surrey and Arup to assess air pollution in and around 5 schools in Lambeth. We're using Global Action Plan's Clean Air for Schools framework to help us identify the most impactful interventions. We will then fund and support the school to implement the most impactful interventions in the school environment. This support includes Arup developing technical guidance for schools to inform procurement. Following the implementation, we will then evaluate the impact of the intervention on hyperlocalized air pollution in and around the school. Through this project, we are exploring the impact of interventions like green infrastructure, behaviour change like anti-idling interventions, and interventions beyond the school gate, like school streets and active travel initiatives. We hope to have some findings from this project by the end of the year, and we'll share these directly as well as through our partners. Beyond this pilot, we are running other projects in and around schools, including the London Schools Pollution Help Desk. We have co-funded with the GLA the establishment of the London Schools Pollution Help Desk. The help desk will centralise and coordinate advice and support to help schools across London take action on air pollution. We've got a project called Planting Healthy Air, where we're working with a primary school to redesign its playground to deliver on air quality and physical activity outcomes. And we're also working with Danish design firm GEL, exploring the potential of street level changes outside of primary school to smooth traffic flow and improve pedestrian experience. These are all in different stages of development, and once we have learnings from those, we'll also be sharing those actively. So what have we learned so far? While none of our projects have yet been completed and evaluated, we have still learnt a lot from our initial engagement with schools and partners. So far, we have mainly learned about the challenges faced by schools in tackling air pollution. Many of these won't be new to you, but I'll just repeat them for this purpose. So air pollution is not an immediate priority for most schools, especially more disadvantaged schools who have more immediate educational challenges to focus on. Schools have limited resources to identify and implement interventions, including those related to air pollution. The limited funds also means that they often can't afford to both invest in an assessment of options and fund the implementation, which results in many schools choosing the easiest option or the one that they most easily understand, irrelevant of if it is the most impactful. Similarly, schools generally don't have the technical understanding to identify the best intervention, with it often being left to the head teacher or school business manager to wade through the huge amount of available information. And this again contributes to schools choosing interventions they most understand rather than those which are most impactful. Schools have limited additional staffing and administrative capacity to manage and support the delivery of interventions, particularly those which require engagement. They often rely on a single interested teacher to lead and manage the process. This limited capacity can even affect a school's ability to seek funding to implement intervention, either from not having time to find available sources of funding or because of the time to complete the often complicated paperwork. Finally, and an important lesson for us as a foundation focus on inequalities, is that a focus on parent and community-led campaigns and interventions may exacerbate inequalities, as lower income families and communities may have less time and capacity to support such campaigns and interventions, And even where external organisations are supporting such interventions and campaigns, they may not be able to get sufficient engagement from the schools most in need, and therefore may go to schools where engagement is easier, often less disadvantaged schools, potentially increasing the inequality and divide between these schools. So they're just some of the lessons we've learned so far. We've also learned some lessons about the challenges faced by schools through COVID-19 and how this relates to and will impact our work on air pollution. So COVID has provided us a unique example of the difficulties faced by schools when having to respond to an external challenge, and has provided a useful case study of how to and how not to work with schools to tackle air pollution. During COVID-19, schools have been given difficult to implement guidance which hasn't adequately considered the realities of schools and teaching. This guidance has often placed expectations on schools to make significant changes to the school environment with no or only limited funding or support to make these changes. The reopening of schools has highlighted some of the following challenges faced by schools. These challenges will also impact our work on air pollution. So schools are being encouraged to maximise ventilation by opening windows and doors wherever possible. We've heard of the challenges of teaching with open windows and doors, where increased noise, especially due to staggered playtimes, making it harder for children to concentrate. To facilitate school social distancing, schools are having to repurpose car parks and other available spaces around the school, even where this may push children closer to busy, polluted roads and dangerous traffic. Months away from the classroom have increased behavioural issues, requiring teachers and support staff to dedicate more time to assisting students, which again reduces their capacity to support other programs and initiatives, including those related to air pollution. The government has also provided minimal funds to most schools to make the necessary adjustments to minimise the risk of COVID transmission in school. This has resulted in schools having to utilise their limited reserves to make these changes and protect students. This means that there are even fewer funds available for other programs and interventions, including those related to air pollution. So these lessons about the challenges faced by schools, and particularly those lessons from COVID, have taught us a lot about how we as a foundation plan to work with schools in the future, and lessons about how not to work with schools if we want the impact that we really care about. Based on that, we've developed a set of principles which will guide our and our partners' works with schools going forward. So number one is to consider if the school is or should be the responsible party, and if not, to identify who is and work with them instead. We wouldn't really expect schools to manage traffic outside the schools, so should we be expecting them to manage or take the lead on addressing pollution beyond the school gate? In many cases, no, and we should therefore be working with local authorities or other responsible parties, including polluters, to take action. Where possible, it's important to align interventions with available sources of funding. If we do this, there is a greater chance of uptake, and it will likely deliver on multiple objectives for the school, including cost savings and air pollution reduction. It's important to consider aligning interventions with existing priorities and objectives by framing the intervention around its ability to also reduce costs through energy efficiency or to improve performance through reduced levels of CO2. It is more likely to be tangible to the school decision maker. We are also wanting to align interventions with existing decision points. As I mentioned earlier, schools have limited times and capacity, so to make it easier for them by aligning or timing the proposal with another decision point, either planned retrofits or planned maintenance. Ensuring guidance is targeted and tangible. To help bridge the technical gap, we want to make sure that guidance gives schools the information they need to take action. So particularly thinking about procurement advice, or at least considerations, questions to ask a contractor. We want to look for opportunities to partner with organisations already working in and around school environments. So by working with facility managers and etc., we will help reduce the burden on schools. This may also help us identify a path into potentially a larger number of schools and to share learnings across schools. Most importantly for us, we need to consider who is expected to identify, procure, manage the implementation of intervention, as well as maintain it. And wherever possible, reduce the administrative burden on the school or provide additional support where that burden can't be reduced. So those sort of 7 principles are guiding our work and helping us develop new projects. And we believe these will be sort of helpful to us to maximize our impact. So thank you very much, and I'm happy to take questions now or later via email if that's helpful.
Thank you very much, Anthony. It was very interesting, and it's obviously a very interesting program that you're involved with, and I can see quite a lot of connections with the work of Tapas, which I hope we'll take forward in the future.